everyone, my name is Santi. I hope you're having a great day today. Today I will be talking about the RSV prevention in infants. Today's overview, I will be talking what is an RSV. I have also included a special fun activity for us. What do you think RSV means to yourself? This will show me what you have the experience of learning about it, and I can see what our classmates say, and also our professor, what she thinks as well. And I also included the development of the vaccine, which is like the timeline, some side effects on the RSV, some age classifications in the RSV related hospitalization chart. I've included the map of descriptive epidemiology, which shows you like all around the country, like which spots have the most impact on RSV. The descriptive epidemiology, when I researched on my paper, the immunization chart, some monoclonal antibodies. I've also defined what monoclonal antibodies is. There are two antibodies of the monoclonal, which are nirsevimab and pelareorep. The potential risk factors, the side effects of the safety of the vaccine, the public health aspect, since we're all in the health aspect of learning more information on particular diseases, and the significance of the RSV. On here you can see I've incorporated the link in both spaces under, like on the bottom where it says scan the QR code on your phone if the link doesn't work. And our code is going to be pound 5765. And I've also added on the right side corner that says link. So try it out. See if you can scan the QR code and let me know, what do you think about it? What is RSV? RSV is defined as a respiratory syncytial virus that's highly contagious for all ages, but mostly commonly found in infants, which is scary if you think about this, which can cause bronchiolitis and severe pneumonia, which leads to hospitalization. The development of the vaccine. In 1956, the RSV was classified, and it was established for a lead cause of death. This is scary because this is coming through the severity respiratory illness and hospitalization amongst infants for several years. In 1960, there were early stages of the vaccine trials, which became unsuccessful. They had to go through placebo trials, and eventually in 1998, they found a vaccine that was called the pelareorep, which was approved for the hospital use. And further down in 2023, there was modern vaccines that were licensed, and nirsevimab was presented. So which basically means like there are two different types of vaccines. They have some potential, but they had to see, okay, if one wasn't working, what was another way? It's basically like COVID-19 strains. As I mentioned in my timeline, 1956, the RSV was identified. Then the first vaccine was on the first trial in 1960. In 1998, pelareorep was approved for infants at risk. And then in 2023, maternal RSV vaccines were approved. Nirsevimab was introduced. Some potential side effects and symptoms of the RSV vaccine. So for adults like mothers who are pregnant, basically, they had headaches, fatigue, low-grade fever, muscle aches, pain in the injection site, like which is usually by the shoulder. And for infants, they were usually fussy, having a mild fever, a mild rash, and some serious allergic reaction, making their tongues being bluish tint, and some redness at the injection site. In the chart we can see that the light pink has more comorbidities, and the dark pink bars explain if they had non-comorbidities, and this means they've gotten hospitalization. Here's the map of the descriptive epidemiology, and here you can see, if you look very closely, United States has a lot of outbreaks as well. India, Australia, China, for instance. And like in this little lovely pie chart, you can see basically majority of the population was up in China, as I mentioned before, in all of the European community, and even in the American, like South American and North American, all had it. So it's kind of scary. It goes through every country. Even one little country didn't get it. It's just like that. And immediately it will come from spreading from other countries. Like if a patient comes traveling from a different country, they don't want to wear their mask. That's easily spreading germs and infections. So that's why most citizens decide, okay, if I don't get the vaccine, I don't think I'll get it. But lately, what's been happening is a lot of citizens are getting it, regardless if they had the vaccine or if they did not. Which is scary because it's like the COVID-19. In the descriptive epidemiology, like we can see the person, as I mentioned, the high risk are infants younger than 6 months. And for adults who are 60 plus and who also have an immune system that is weak, which can causing a severe bronchiolitis, pneumonia, and dehydration and hospitalization. The places are worldwide in developed and developing countries. Limited healthcare resources increase the severity of illness and delay in treatment. The time, it's usually during the seasonal times, which is like in the fall and the winter time. There have been so many outbreaks that have been increased the ER visits and hospital admissions. Here in this chart, you can see in the immunization that protects severe RSV chart. This talks about the recommendations on how to prevent RSV prevention in various groups. This includes the vaccines for pregnant mothers and other adults with the monoclonal antibodies for EIU for infants. And this also demonstrates the preventive strategy on protecting those who are in high risk of severe RSV, as we can see if I zoom in very quickly. Like if we want to see it, like in babies, we can see that RSV antibody is given to the baby. And it says all infants whose mother did not receive RSV vaccine during the pregnancy, and some children ages 8 through 19 months have the increased risk of the severe RSV. And when is this available? It's usually available during October through March. So the monoclonal antibodies, it is usually defined as a laboratory produced antibodies where it can be used as a passive immunization. It specifically targets proteins on the surface of the RSV, which could potentially help prevent from infecting the human cells. Some examples of the monoclonal antibodies: nirsevimab is the preventative antibody injection that helps infants on reducing the severity of the RSV infections throughout the respiratory tract. And the plazimabam, it's similar, but it helps infants who are in higher risk of developing severe RSV diseases, and it also helps with people who have chronic lung diseases or potential heart diseases. Some potential risk factors are chronic lung disease, so that's like bronchopulmonary dysplasia, congenital heart disease, as I mentioned before, exposure to tobacco smoke, which is a risk of severe respiratory illness, Neuromuscular diseases, condition of the affect airway of the clearance. Premature babies who are less than 37 weeks gestation. Weak immune system, which are who are immune compromised. The safety of the vaccine, some benefits outweigh the risks in reducing severe illness and hospitalization. Generally safe and tolerated for all ages. There are some mild to extreme side effects, but it's not completely severe. The public health aspects, since we're in our lovely public health class, some we can see as reducing infant hospitalization and severe illness, protects vulnerable infants through the vaccine and monoclonal antibodies, and it decreases in the healthcare systems that have a burden through the RSV outbreaks. And eventually it promotes prevention, education, and early protections on outbreaks. Why this is significant: it decreases on the burden of hospitals, supports ongoing health education and prevention efforts, improves health outcomes for infants and families, protects newborns through maternal vaccines and monoclonal antibodies, reduces severe RSV-related infant hospitalization. And to conclude my presentation, RSV is basically the major cause in infants for severe respiratory illness. Side effects, as I mentioned before, are mild to temporary or to extreme depending on the situation. Both vaccine and monoclonal antibodies reduce RSV-related illness. There's been still ongoing medical research of the vaccine, along with public health and education is necessary. So these are my references that I used. And that's it. Thank you for enjoying my presentation. I hope you guys enjoyed as much as I did researching about the RSV in infants and how we can prevent it. If you have any questions, you can always contact me on our discussion board to know more about this RSV. Thank you. Have a good one. Bye.